pretty frequent in large senior breed dogs. German Shepherds are one of the poster children, but also frequently seen in like Labrador retrievers, some golden retriever. Clinical signs are what I hear people complaining about the most. A lot of reluctance to jump, reluctance to get on furniture, maybe jumping on the couch or jumping on the bed like they previously did. Slow getting up, especially from like a laying down position. Maybe they're uncomfortable getting into a sit position. Reluctance to use stairs, particularly going upstairs. A lot of times owners will report that they don't want to go up, but they're fine coming down. Some of those dogs that we see who have high tail carriage, or maybe some of the twisty curly tails, they'll start having a lower tail carriage. And sometimes we'll even see a unilateral pelvic limb lameness. So LS is always one of my rule outs, even when I'm thinking about a torn cruciate or some sort of stifle disease. I always want to check the LS as well, because it can be a cause of one-sided hind limb lameness. And then sometimes when we get to really progressed compression, we'll have urinary or fecal incontinence. So diagnosis, how am I figuring out that we've got some LS problems going on? I largely base this on clinical exam. In the practice I'm at right now, we don't have any diagnostic modalities. So if I haven't gotten diagnostics from a general practitioner or a specialist, we're basing this a lot on physical exam. Most commonly, I have pretty marked pain on direct palpation. A lot of dogs, when I'm palpating a painful LS, will really sink into their hind limbs and lower. So they'll even kind of cry, turn around. I find that most dogs with lumbosacral compression are quite painful on palpation. They can also be painful on dorsal tail flexion. So if we're raising that tail while they're standing, they might cry or sink lower. And occasionally we'll have CP deficits. This is usually in pretty advanced cases, so I don't see that all too often. But those are some of the biggest things that I'm looking for. Also, since I'm fortunate to work in a facility with a lot of rehab toys, we'll put them over Cavaletti poles and see how they are picking up their pelvic limbs, or if they're scuffing or knocking feet on those rails. But that's usually the biggest pieces of a clinical exam that I'm looking at. So sometimes these guys come in with radiographs, most commonly. So there's an image on the screen of L7, S1, just kind of showing that narrow disc space there. Sometimes we'll see like a bridging spondylosis, but that's usually what more dogs have come in with because they haven't had all of the advanced imaging. So of course, an MRI would be the gold standard for diagnosis, and can help us identify severity of compression if one side is more compressed than another. But not everyone has the option to do an MRI. And a lot of dogs I see haven't even had radiographs yet. So I personally encourage at least radiographs at first, because we want to make sure there's not any spinal neoplasia going on before we send any shockwave or laser or anything else in there. But a lot of times owners don't maybe have that option. So we'll go ahead and treat with some of our different modalities. Picture of a German Shepherd, because they're so commonly represented with LS disease. One of the theories is that particularly in working dogs, it's a problem because of all of their activity, jumping, climbing walls, all the bite work that they do. It just causes really exaggerated spinal extension. So it's a pretty common problem in these working dogs. And then our goal is to get them back to work comfortably and safely.